Yeah, hi. Thank you so much for agreeing to talk to me today. I think just to start, if you could introduce yourself and just your educational slash career journey, I guess, like your high school, where you went for undergrad, and what you're doing right now. If you could sort of talk about like that would be really cool.
Okay, sounds good. So my name is Olivia Panchal. I'm a third year medical student at the Texas College of Osteopathic Medicine in Fort Worth, Texas. And I did my undergrad at the University of Southern California in Los Angeles, and I majored in human biology and minored in Spanish. And then after I graduated from USC, I did a 1 year master's program at the University of North Texas, also in Fort Worth. And so
Okay.
I'm a third year and I've got 1 more year of med school left.
Oh, so you've studied in California too. Are you originally from there, or did you like move under?
No, I'm actually originally from Oklahoma, and
Oh,
then I just wanted to go to LA, so I went to college at USC. Loved it, but all my family's here in Oklahoma and Texas, so I moved back for med school.
okay, yeah. So, my first question to you is just sort of how you developed an interest in medicine. Were you introduced to it like maybe in high school, or did you like develop this interest later on? And then why did you specifically, decide like you're studying at an osteopathic school, right?
Mhm.
So, like, how did you decide that that's what you wanted to do?
Sure. So I think I've always wanted to be a doctor. I've always been interested in medicine and anatomy and the human body and kind of just was always interesting to me. My dad is actually a doctor, so pretty early on, like I would talk to him and like go to work with him, and like he would tell me about his cases and his patients and things like that. And so I kind of always had an interest in it. And then in high school, I started to kind of explore other things that I might be interested in. I thought for a little bit that I might want to go to law school or like be like an international diplomat because I was really interested in international relations and politics.
Mhm.
But ultimately, like I don't know, it was always drawn to it, and there was nothing else that I could really see myself doing as a career for the rest of my life. And so I ended up deciding and sticking with medicine and been happy with that decision so far. As far as going to an osteopathic medical school, so I did my master's degree at the same school where I'm in medical school now. So I was lucky to get kind of a little bit of an exposure to the campus and the faculty and kind of what the medical school was like before I actually started. And I just felt really comfortable here. I really liked the faculty a lot. I really liked the sense of camaraderie at my school between students. We collaborate well together, we work well together. It didn't have that kind of cutthroat aspect that you can kind of see at some medical schools where it seems
Mhm.
like people are competing against each other rather than working together. And that just didn't really appeal to my personality. And so that's why I really liked TCOM a lot. I've absolutely loved being at TCOM. I've made a ton of really good friends that I think I'll stay friends with long after medical school. And I've gotten a lot of great opportunities, especially opportunities for research. Another thing that I considered when deciding where to go to medical school is I knew that I wanted to do orthopedic surgery or at least some surgical specialties. So I looked at the match rates for the schools that I was applying to see
Mhm.
where students were matching. And TCOM has been really successful at matching students into orthopedic surgery for a long time. And so I knew that if I went here, I would have a good chance and be supported if that's what I ended up deciding to do.
Okay, so I have a couple of questions now, but I first wanted to ask you about like your master's degree because
Mhm.
I mean, just based on what I know, I just always thought that like you finished your undergrad and then you went into medical school, and I didn't really like. I guess that you could, I mean, have a master's degree, but I just wanted to ask you about how you decided to do that or how you had. I'm not sure. So if you could
Yeah.
explain that, yeah.
Sure. So I think it's becoming a lot more common for people to take gap years in between graduating from college and starting medical school.
Mhm.
I personally took 3 years off before or between finishing undergrad and starting medical school. And I really recommend it to students because a couple of reasons. One, it's an opportunity for you to do other things that you're interested in before starting medical school. Medical school is a very long journey, medicine in general. You'll do medical school and then you'll go straight into residency and then maybe a fellowship and all this training and education. It's a very long road before you actually start practicing as a physician. And so if you have any other like interests or things that you enjoy, whether it's travel or some other field of study that appeals to you or a hobby, it's a good time to kind of explore those hobbies before you kind of start down this long road of medicine. Another reason to take a gap year is just to get life experience and work experience. So I think I worked as a teacher in between medical undergrad and medical school, and I think that taught me a lot about how to act professional in a workplace. Having a regular 8 to 5 job, work ethic, just kind of some of those things that you wouldn't necessarily get if you've only ever been in school. And so I think that was a really valuable experience for me. And then part of the reason why I decided to do the 1 year master's program is because I had been out of school for a little bit. And so I wanted to demonstrate that I still had, um, the academic talent and academic success to succeed in medical school. So I did the 1 year's master's program before I applied to medical school, just to demonstrate that, this is still what I want to do, even though I took some time off in between undergrad and medical school, but I could still be a successful student in medical school. So that's a lot of people will take a 1 year master program. Sometimes people will do a master's program if you majored in something in undergrad that didn't fulfill the prerequisite requirements that you need to be able to take the MCAT and to apply to medical school. So for example, if you majored in something like political science and you didn't take biology, organic chemistry, physics, things like that you have to take to apply to medical school, people will do a 1 year's master's program where they take those classes. And so that way they can meet the prerequisite requirements for medical school. And then sometimes people will take them if you maybe might have struggled in undergrad and you want to demonstrate that you or like boost your science GPA, you could do a 1 year master's program as well. It's becoming a lot more common. A lot of people at my school took gap years in between undergrad and medical school. And I think, it's a lot more common now than it used to be.
So is it like easy to sort of transition from a master's degree and like get placed into medical school, or is that?
So I think it can definitely help if you've got weaknesses on your application. It can definitely strengthen those aspects. But I wouldn't say that, I mean, getting into medical school is never easy. There's
Yeah.
no easy way about it. It is just a really hard thing to accomplish. And so if you've got weaknesses in your application, it can be a good way to strengthen those and strengthen your application for medical school. I will say that because I did my master's program at the school that I go to now, I think it did help because I was familiar with the faculty and I had letters of recommendation from people that are on faculty at my medical school. And so I think that helped. But I wouldn't say that every person who did the master's program at my school ended up getting into TCOM. So yeah, it's definitely not a guarantee, but I think it did help in some ways.
Okay. Yeah. So the next question I sort of had for you while you were talking previously is sort of how you got into surgery specifically, because you said that that's what you said you wanted to go into orthopedic surgery.
Yeah.
Right. So how did you decide that that's exactly what you want to do? Because again, I think surgery has like a lot of like your fellowship, your residency, everything's gonna be like a long journey, and it's
Yeah.
like a big commitment. And just surgery in general, like, why did you think that you were a good fit, or like, why were you interested in that?
Yeah, sure. So, for me, I first got so I'm planning on applying orthopedic surgery next year, and so I got my first kind of exposure to orthopedic surgery when I was in college. I did research during undergrad on ACL injuries and in amateur athletes and working with athletes and getting them to return to their level of sport after an ACL injury. And so that's kind of how I got exposed to orthopedic surgery. It's an interesting field because it's one of the few surgical specialties where you can be an orthopedic surgeon and operate on any part of the body. So you're not confined to one area, for example, like a brain surgeon or a heart surgeon. You can be operating on an arm, a leg, the pelvis, hand, foot and ankle. Like there's so many subspecialties within orthopedic surgery that I think it just appeals to my interest of never, like, I don't think I would ever get bored. I think there's just so much variety within orthopedic surgery that I would never get bored of it. And then as I went into med school, I shadowed orthopedic surgeons and I've done a few rotations now in orthopedic surgery. And I think orthopedic surgery is really interesting because you have the ability to improve a person's quality of life very quickly. So if someone comes in with a broken hip and they're unable to walk, a simple, it's not simple, but a short procedure, a 3 hour, 4 hour surgery, and that person regains their ability to walk. And so that I think is a really cool aspect of orthopedic surgery and improving people's quality of life. I love being in the operating room in the OR. It's like my happiest place to be.
Mhm.
I love working with my hands. I love kind of the hands-on aspect of that. That kind of appeals more to me than like the long-term management of healthcare problems. So I guess the alternate, like the opposite of going into surgery would be, going into medicine. So like internal medicine, family medicine, more primary care, in which you're managing a patient over a long period of time and you're helping them through health problems for their whole lifetime. And you might be managing diabetes or cardiovascular disease and kind of, or like kidney disease on a long-term basis. And personally, to me, that kind of, I just don't have the patience
Yeah.
to like manage patients for that long of a period of time. And I know there's people in my class and people that are really cut out for that. They have that patience, that willingness to want to improve um overall patient healthcare. But that's just not what appeals to me. I love being in the operating room. And I love kind of that immediate gratification that you get from surgery.
Okay. Um, okay, so what is your experience at medical school sort of like, and what is a daily, what does a typical day sort of look like, or do you even have like a typical day?
Yeah, so it depends on what year you're in med school. It kind of changes throughout med school.
Mhm.
So my school, what we do is your first 2 years of medical school are your like preclinical classroom learning years, and that is pretty similar to what college is like. And then your third year of medical school, you're doing rotations, so you rotate through all of the common specialties, and then you get a couple electives where you get to choose what you want to do. And then fourth year, at that point, you've decided what specialty you're going to apply to. And so you do rotations only in the specialty that you're planning on applying to. So first and second year, um, it's classroom learning. So, you have like exams every couple of weeks. And you have you'll have like your core class that you're in. So for like your block. So for example, a GI block. And so you're learning
Mhm.
all of GI for that period of time. And then you'll have an exam on GI at the end of that block. And then you have some other like clinical classes, like you have a class on physical exam. You have some classes on like medical ethics or like health promotion, other aspects of medicine that are a little bit more clinical that
Mhm.
supplement your classroom learning. And so that might be that day or like those couple of years, it might look like, waking up early, going to class, um, and then like going to the library to study for your exam, kind of similar to what college is like. And then third year, which has been my favorite year of med school so far, is because you're actually getting to be in the hospital, treating patients, working with residents and attendings. That just depends on what rotation you're on. So, for example, family medicine might be Monday through Friday from like 8 to 4, you're at work. If you're on surgery, the hour's a little bit more unpredictable. So you might, be getting into the hospital at 5 a.m. And then depending on how many surgeries there are that day, you might be leaving at 6 p.m. and then you might be taking calls. So you might be there overnight. So it just depends on what the specialty is. So it can vary a lot as you progress through med school. But I would say the first 2 years are pretty similar to what it's like being in college, and you're studying and you're in the library a lot and taking exams and going to lectures and things like that. And then third and fourth year are more hands-on.
Okay.
Mhm.
So you sort of told me about what you liked about surgery, and you said that you liked being able to see your results right away.
Mhm.
And yeah, actually, before talking to you, like a couple of last week, I was also contacting other people, and I interviewed a professor of surgery at UCSC, and then
Uh-huh.
he was also like, "Yeah, I'm not patient. I enjoy like seeing the results right away. Like it's
Right.
different from other fields because you know the change that you've made." So we sort of talked about what's rewarding, but I also wanted to ask you about what's maybe challenging about surgery or just medical school. Like, what's challenging about the field you're interested in?
Yeah.
Also, if you
So
have sorry, you have
uh-huh.
other things like you think are rewarding, like I do this because of this. Yeah, you can maybe like talk a little bit about what's gratifying, what's challenging.
Okay, sure. Yeah. So some of the challenging aspects of surgery, um, Surgery is a very like for a patient to undergo surgery, it's a very difficult decision and it's a very intensive and hard process to undergo. And there are no guarantees. So sometimes you offer a patient surgery and you hope that the surgery will help them and it doesn't, or they have some complication after the surgery. And that can be really challenging because you've put your patient through this really difficult thing and you weren't able to get them the outcome that you wanted or that they wanted. And so that can be a really challenging aspect of surgery. Um, Another challenging aspect is, like you said, the commitment. It's a long, long road and it's a lot of hours, and you work really hard as a surgical resident. And that can be, I've gotten a taste of that as a medical student of what that's like being a surgical resident. And that
Mhm.
can be really, really challenging, especially over a 5 year period. It can be difficult on you and your significant other, your family. If you have kids, that can be really hard to balance both work and having a family. And so those are some of the more challenging aspects of surgery that just kind of come with the training. And so if you are interested in surgery, those are all things that you have to think about if it's, worth it for you to go through all of that.
Mhm.
For me, there's nothing else that I would want to do besides surgery. So it is what it is, and I'm willing to put up with that. But it's something for every medical student to consider if they're deciding if they want to go into surgery. You have to also consider those personal aspects and how that would affect your personal life as well. Um, I think that's like the main challenges, but yeah, I ultimately find it very rewarding. I think you can help people. You can help people in all fields of medicine, but I think like that professor of surgery said, you can immediately see how you've helped someone and how you've impacted their life, and I think that that is especially rewarding.
Okay. So yeah, so you sort of started to talk about how it's like a long process and a long journey. Um, so how do you sort of manage your time and maintain like spend time on your other passions and interests is one question I had. And just
Mhm.
what are some things you were involved in undergrad or you're involved in now that sort of help you with what you're doing or just help you better yourself as a person?
Mhm. Sure. So, yeah, it's very hard when you start medical school. It's like a huge learning curve. Um, oh, 1 second.
Mhm.
Let me just respond to this text. It's my groceries are being delivered, so I have to
Oh,
to my building. It's on the second floor. Okay. All right. What was I saying? Oh, so okay, so when you start medical school, the transition from undergrad into medical school, or if you're in a professional career before starting medical school, that first year of medical school is a very steep learning curve. It's a lot of information, it moves very quickly, and it's very challenging. And it's really important in that first year that you still maintain time for your hobbies and interests outside of medical school. That eating, sleeping, exercising, all those things. And it's easier said than done. It was really challenging for me my first semester of medical school to kind of maintain those other things. But once I kind of figured it out and I got into a rhythm, figured out what my study schedule that worked for me was, um, I got a lot better at that. And now I think I'm better at managing my time. Um, Third year, it just depends on, like I said, the rotation that you're on and what your hours are like. And so some days you might not make it to the gym. You might have to pick up food on the way home because you don't have time to cook. And other days, it's a little bit of a lighter schedule. So you have more time to study because you still have exams during third year too. So you have to study for those exams in addition to working at the hospital. And so I think it's just important to identify the things that are important to you outside of medical school, whether that's a hobby or spending time with your family, or, for me, it's going to the gym. Like that's like my outlet. And so I have to make time for that on a daily basis. And so whatever I need to do to make time for that is what the priority is. And so you kind of learn to manage that over time. Um, And yeah, it gets easier, but it is pretty hard at the beginning of med school to figure out that balance because it's just everything's moving so fast and there's so much information to learn.
Yeah.
Yeah.
Okay. Um, my next question. Okay, yeah. I sort of wanted to ask you about the differences between a DO degree and an
Mhm.
MD
Yeah,
because
sure.
yeah.
Okay, so in the United States, there's two different medical degrees that you can get, an
Mhm.
MD or a doctor of medicine, and a DO, which is a doctor of osteopathic medicine.
Mhm.
Um, historically, like back in like the 1800s, osteopathic medicine was created because at that time, allopathic medicine or MDs, um, there was a lot of the person who like started osteopathic medicine felt like allopathic medicine was not focused on the whole patient and like kind of viewing the patient as a whole and taking into account the patient's environment, the patient's family life, like where the person lives, what the person's financial status is, things like that, that also contribute to health. And it was kind of more just like it was honestly kind of barbaric back in like the 1800s. They were like leeching people and cutting off people's limbs and stuff
Mhm.
like that. And so obviously it's not like that now, but like the principles of osteopathic medicine that began in the 1800s was kind of this idea of viewing the patient as a whole
Mhm.
and using the natural mechanisms of the body to help heal itself. And so kind of just encouraging the body to heal, which sounds very like hoo hoo hippie hippie now, but like that's kind of how osteopathic medicine began. And so now, like fast forward to what it's like now, as
Mhm.
far as like what specialties people can practice or like prescribing medication or where you can train and what residencies, there's no difference. So osteopathic DOs practice in every specialty of medicine, just like MDs. We prescribe medication. We can be in any residency program, same as MD students. So there's no difference really in terms of the career trajectory for a DO versus an MD. The only difference during medical school, there's a couple things that are different for MD versus DO medical school. So in an osteopathic medical school, in addition to everything that you would learn at an MD school, like all your basic sciences and your systems and physiology, anatomy, all that stuff that you learn at any medical school, you
Mhm.
also have this one aspect of your curriculum called osteopathic uh, manipulation. And so basically, what osteopathic manipulation is using hands-on techniques
Mhm.
to help heal. So kind of similar to physical therapy. Um, Kind of like a physical therapist, kind of like a chiropractor. So using kind of like stretching techniques or like different hands-on mechanisms. It's hard to describe, but kind of like hands-on things that you can use to heal the body as opposed to medicine, like prescribing drugs or surgery, stuff like that. So kind of like a more hands-on aspect. So you learn that while you're in medical school. And then
Mhm.
the other thing that's different is the licensing exams that you have to take. So at an MD school, you take, and when you're in medical school, you take the USMLE step one and the USMLE step two.
Mhm.
At DO school, we take COMLEX level one and COMLEX level two. Same thing, tested on the same concepts. The only difference is that the COMLEX, the DO one, also has questions about this like osteopathic manipulation that we also learn in medical school. So it's like that plus, it's like what's on step plus some extra stuff. But
Okay.
DO students can also take the USMLE step one. So for example, I took both.
Mhm.
So I have to take the COMLEX to be able to graduate from my medical school, but I also took step one, the USMLE step one. So I took both exams. So really not that big of a difference in that regard either. And then after practice, like some osteopathic medical students will use kind of the osteopathic manipulation that we learn in school in their
Mhm.
practice every day, but a lot of them don't. I don't plan to as a surgeon. There's like a handful of surgeons that do use those techniques in their practice, but there's no obligation that you have to if you
Mhm.
don't want to. So pretty much after you graduate from medical school, it's all the same.
So really there isn't like a big difference.
There's no big difference.
But do you think, I
Between
think MD degrees are more common though. Do you think there's,
there are more allopathic MD medical schools than there are DO osteopathic schools. So I think there's like 150 MD schools, and I think there's like 40 DO schools.
Mhm.
So there are more practicing MDs than there are DOs currently, but I think that will change over time. I mean, there'll never be more DOs than there are MDs just because there's more MD schools than there are DO schools. But there are more and more DOs entering into practice every year. And so I think that discrepancy will lessen over time.
So do you think a DO degree only applies to surgery and like orthopedics and that sort of a field, or can you really use that for like any
Oh,
medical?
you can apply it to anything. I think that it applies really well to PM&R, which is physical medicine and rehabilitation. A lot of DO students go into PM&R. Um, it can work really well in primary care, like family medicine, pediatrics. We have a professor at our school that does osteopathic medicine for hospitalized patients in the ICU. So you
Mhm.
can really apply it into any field. And I know that there are surgeons that use osteopathic, like general surgeons that will use osteopathic manipulation in their practices as well. It's really just personal preference of how you want your practice to be after you graduate.
Mhm.
Me personally, I don't think I'll do that, but yeah, it's up to the student how they want their practice to be when they graduate. And then there are some people that will do like a residency in osteopathic medicine specifically.
Mhm.
They're highly trained in those fields, and so they can do that if they want to.
Okay. Um, this we don't have too much time left. I don't want to take up too much of your time, so just like a couple of questions.
Okay.
Um, I was just wondering like what your future plans are, and then just at the end, if you can give like a piece of advice to like a high schooler listening to this,
Mhm.
or maybe like yourself when you were a high schooler, what would you say? Yeah.
Okay. Yeah, so my plan is next year or in September, I guess, of this year, which is soon, I'll submit my application for residency in orthopedic surgery. And I'll do rotations in orthopedic surgery all of next year. And then match day for me, is in March of 2024. So in March of 2024, I'll find out if I matched into orthopedic surgery and where I'll be going for residency. So that's my plan. And then as far as advice goes, um, I'll break it down by like advice for a high schooler versus a college student. So if you're in high school and you're interested in medicine and you think that you would like a career as a physician, I would say in high school, see if you can shadow a doctor in your area for a day and just kind of see what it's like to be a doctor. Kind of see if you can shadow in maybe a couple different specialties that you might be interested in, get a sense of what surgery is like, get a sense of like what primary care is like. Usually, doctors are very amenable to having students, and they'll be happy to have you for a day just to shadow and see what it's like to be a physician. So that's one thing you can do as a high school student.
Mhm.
And then getting involved at like volunteering at a hospital or doing something like the Perry Initiative, where you can kind of learn more about orthopedic surgery if that's what you're interested in. Those are all great things to be involved in as a high school student. But I wouldn't put too much pressure on yourself to, you don't need to be doing research or anything while you're in high school. Just try to get exposure to the field and see if it's something that you would be interested in.
Mhm.
Then as a college student, that's when you want to start thinking about maybe getting involved in some research that pertains to medicine, talking to current medical students, and looking at different schools and deciding if you want to do MD or DO or where you want to apply to medical school, take the classes, the prerequisites that are required for taking the MCAT,
Mhm.
uh, things like that. Like my biggest advice always though is that I always tell both high school students and undergrad students is comparison is the enemy of success. And what that
Mhm.
means is you just got to do what's right for you. Don't look at what your classmate is doing, what courses they're taking, what order they're doing things, when they're taking the MCAT, what schools they're applying to. You really have to tailor this whole process to yourself and do what's best for you. Taking time off between undergrad and medical school is what works for you. do that. There's no harm in doing that. I think that I gained a lot of valuable life experiences by doing that. If you want to go straight from undergrad to medical school, that's fine too. But just do what's best for you and try. It's really, really hard not to compare yourself to other people, especially when you're in college and you're pre-med and there are other people that are applying to medical school too. But yeah, comparison is the enemy of success. So just try to just do you and focus on yourself and bettering yourself. And I think that's the best advice that I can give to both high school and college students.
Okay, yeah. Well, I guess this is like the end. This is the end of our interview. I
Okay.
just want to thank you again for like taking the time to talk to me because there's no reason for you to like do anything like this, but it's really helpful to be able to talk to different people and just get an idea of what we might be interested in or what like whatever. So if you want to go into medical school, sometimes it's like this idea, like I want to be a doctor, but you don't
Right.
really understand what it's like, the things you have to put in, all of that. So it's helpful to talk to people and really think about is this really what I want to do? So yeah, I just want to thank you for your time and like all of your great insights because I learned a lot of new things and I had fun talking to you.
Cool. I'm glad. Yeah. Anytime you need anything, you have my email address. If you have questions about med school, applying, or even undergrad and what classes to take or how to do stuff, I'm happy to give my advice on anything you need help with.
Yeah, thank you. Thank you so much.
Yeah, no problem. All right. Have a good